Okay, we have seen hospital operations management where we have divided the hospital operations topic into a various subsections. There was a first section which consists of OPD and outpatient services and nursing services. Outpatient services also we have discussed in detail in last topic, last time. Now we will be seeing about the nursing services. So basically, what do you mean by nursing services, or what do you mean by a nursing unit? It is also called as a ward, which includes patient accommodation and nursing service facilities. So basically all hospitals have an indoor ward or indoor unit, which is called as nursing unit, where the patient is getting admitted to avail the medical and nursing services. Nursing unit will be consisting of patient beds. It will be consisting of a nursing station where the nurses can sit. It would be consisting of a service area where the nurses can roam around or can do the procedures on the patient. It will be consisting of a storage area where the linen is saved, where the drugs can be saved, where the files can be kept. It would be also consisting of a work area and sanitary area. So there would be a sort of when you say work area is also a area where they can do the procedures, and sanitary area is basically where there would be a toilets and washrooms. So that all is included into a nursing unit. So before coming to the nursing services, we would be first discussing about the nursing unit and the planning of nursing unit, and then we'll move to the nursing services, because nursing services is basically more of the quality of nursing services is dependent upon how the nursing unit is created, how much it is staffed. So basically that is what where we will be seeing it. Basically hospital has two types of a patient: outdoor patient and indoor patient. Outdoor patient or OPD services we have seen last time, and indoor patient services, the major component of indoor patient services would be a nursing services, which comes second. First is the medical services and second is the nursing services. So ideal nursing units should have best possible physical facilities which result in high quality of nursing care, operating at lowest possible cost, and should provide desirable patient environment and provide a congenital work environment for nursing and medical staff. So as I told you, actually nursing services, why we are discussing before starting the nursing services as a nursing unit, because nursing services is to large extent is depending upon the nursing unit, like what are the physical facilities available in the nursing or nursing unit or the ward, then how this can result into a quality of nursing care, if that we'll discuss in this topic. Then it has to operate at lowest possible cost, because if the cost is more, and then the hospital cannot make any profit out of it. It should provide a desirable patient environment, like patient should be get treated, patient should feel well, and that's how he will get treated. It provide a congenital work environment for nursing and medical staff. Actually medical staff and nursing staff, they have to work very closely to give a services to the patient. So there has to be a good coordination and communication between a medical and nursing staff. So that's why we will be discussing about the nursing unit first and then the nursing services. So initially actually nursing unit started as a Nightingale ward, where we used to call as a nursing unit as a Nightingale ward, or the ward used to be the ward ka jo the format of the ward is to be called as a Nightingale ward. So traditionally it was based on the ward concept which was established by the Florence Nightingale. That's why it's called as a Nightingale ward, which centered around the head nurse, and it has a self-contained unit for 35 to 40 patients with its all arrangement for kitchen, supplies and stores. So here is a diagram of a nursing Nightingale ward. So we have this ward. I will be discussing this. So if you see this is a Nightingale ward. Even today if you'll go to the any civil hospital or district hospital, there this general ward have the same concept, which is called as a Nightingale ward. These are the green sticks are the patient beds, where the patient are there is a row of patient, almost 10 to 20 patient on this side and 10 to 20 patients on this side. This blue color is the one which is called as a nursing station, where these nurses would be sitting, where these nurses have their own arrangement to sit. Then we have this four corners. If you see this four corners, this corner is basically into a sort of a utility area, or the where you say sanitary areas, where would be a washroom, basins and all would be in this area. So that is a washroom and a basin area. This would be a kitchen supplies, this kitchen area where they can cook. So this is a kitchen area. Then this is actually a supply area, where these nurses can go and use the can take the medicine, can use the injections, can take the cotton swab. So this is an supply area. And this fourth is one which may be related to again a clean utility area, or it would be basically an area where you can keep the other instruments which are not into a medical supplies, but other like cleaning the floor and all, that would be kept over here. So these are the four areas, or it can be other way: cleaning utility area and sanitary areas are this side, and kitchen and the medical supplies are this side. And this is a nursing station, and these are the patient beds. So this is an ideal Nightingale ward, which we also see today also in a general hospital or in an city hospital general ward, where the patients are facing, and it has a 35 to 40 beds in an ward. Then there is a head nurse over here. Along with head nurse, there are 3 to 4 more nurses. They have their own kitchen supplies, they have their own medical supplies, they have their own sanitary areas like washroom and the toiletry areas, and they have their own clean other services area where they can keep the other instruments which can other supplies which has to be needed for day-to-day operation of this ward. So if you see, this unit or this ward is fully equipped on their own. Even if the other hospital ward is not coming or other department is not working, they can do their day-to-day operations on their own. But there are some advantages and disadvantages of this ward.